people get internal head injuries?
Luckily, it's a minority.
Okay.
Most external ones are the majority, but we do see them. And the warning signs that we talked about before are quite important, and the mechanism of injury as well.
So how would you get an internal head injury?
The amount of energy transmission is more intense. You know, falling from a height, falling from a ladder, falling down the stairs, motor vehicle collisions. Unfortunately, some of these injuries are non-accidental, child abuse.
Right, and we're going to get into that, but
Right.
it's hard to know how serious the injury is, so it's important to pay attention to these symptoms. So, Dr. T, would you go over these symptoms with us? Are these ones that we definitely have to focus on in the case of internal head injury?
Sure. If the patient loses consciousness, especially for more than a few seconds,
Right.
yes, a couple of minutes, 5 minutes or more. If their level of consciousness remains like that, not fully awake, not totally responsive, oftentimes when the brain is swelling and is what is called herniating, the breathing can become abnormal, so that's an important sign. Also, if there's a large wound, deep wound associated with a fracture, for example, when there's clear fluid coming out the nose or the ears, that could be cerebrospinal fluid from a fracture to the base of the skull. Important. You can also see blood. Any disturbance of speech or vision, you know, talking out of their head, repeating themselves, asking the same question over and over. Pupils that are unequal size, that tends to be a late sign.
Okay.
But unimportant. Keeping in mind that a small percentage, curiously, a small percentage of the population, the normal population, can have unequal pupils. Tend to be subtle, but it can be normal on some people, as you know. Weakness, not moving one side of the body. Neck pain or stiffness because of what we talked about.
Right.
Could be just a sprain or a strain of the neck, but it could be a cervical spine injury that is very important. And seizures, post-traumatic seizures.